everybody. My name is Keely Spring. I'm a licensed marriage and family therapist in the state of California and offer telehealth in Colorado as well. And this is my podcast, Therapeutically Aligned, where normally I interview clinicians about the work they do and how they do it. To that end, I do have two people that were previously on the podcast here for our roundtable discussion. And today's topic is AI and therapy. So, before I turn it over to Abby and Sir here to introduce themselves, I'd like to give a little bit of context of why why we're having this conversation to start out with. So, I am going to read a couple statistics here for everybody. So, these are all from different reporting. They're, the studies on AI are just kind of, coming out now. I think we're going to learn more as we go, but these are some kind of preliminary findings that have been shared. 1 in 8 adolescents and young adults are using chatbots for mental health. So your OpenAI, ChatGPTs, Geminis, Claudes, those type of large language models. OpenAI itself reports that about 1 million people a week are using their platform for mental health concerns.
Mhm.
People report mostly common using chatbots for support around anxiety, depression, and stress are the kind of most, used aspects of that. And there has been a 700% increase in AI companion apps since 2022. And that was just to the latest stats, which were from last year in 2025. The AI therapy business is projected to grow from 1.3 billion to 8.5 billion in 2032. 3 in 10 psychologists report using it monthly. So kind of pivoting to how we are using it as clinicians. 67% of clinicians surveyed are worried about data breach concerns, some privacy issues, which I'm sure we will dive into at some point here. And then 38% of clinicians also worry that AI will replace them at some time. And I'm sure we've all been hearing some of this chatter. I know I see this on LinkedIn and such. So, there's other data here we'll kind of dive into as we talk through things. But before we kind of go further down that path, I would love to turn it over to my panelists here to introduce themselves, what niches they work with. And as I mentioned before, they have both been on the podcast before. So if you are interested to learn more about who they are and how they practice, I would encourage you to go look at their individual interviews, which will also be in the description of this particular roundtable. So it would be easily accessible for everybody. To that end, I believe we're going to start with Abby. Abby, would you mind introducing yourself to the audience?
Yeah, thank you so much for inviting me. I'm really excited for this conversation and what I'm going to learn and what we're going to discuss. I'm a licensed marriage and family therapist, licensed professional clinical counselor here in the state of California. I'm all telehealth, and my predominant population is adults with trauma. I work as a certified sex therapist. I'm certified in cognitive behavioral therapy for insomnia. I'm an expert in ADHD. I'm level 3 Gottman trained. So I work with individuals, partners. Obviously, I do anxiety and depression and other things that kind of fit into the realm of mental health. But I think this growing trend, I see AI as a tool. I'm very interested in how this is going to augment relationships and also the therapeutic relationship or our work in the future.
Yeah, there. Well, appreciate you being here, Abby.
Mhm.
Sir, turning it over to you.
Yeah, thank you. And yeah, thank you for the invitation. Excited to have this conversation with the three of you and with the listener in some way too. My name is Sir Norman Melancon. I'm a psychiatrist. And I'm a general psychiatrist, but I have a little bit of extra specialty in OCD and anxiety disorders. Um, and I work generally throughout most of the lifespan, about teenagerhood and up. Um, I have a private practice here in San Jose, Silicon Valley area, And I also teach. So I teach in primary care. I do medical or I do mental health education as it relates to primary care integration, wellness for residents in training, emotional support for those doctors in training, as well as finding new ways to think about mental health education. So I've been thinking about AI both from the clinician aspect as well as from an educational aspect as well.
Yeah. Thank you, sir. I appreciate the introduction as well. And let's dive in. I will kind of start. My first question is really about are we using AI ourselves? Just kind of level set here for anybody listening. I will, share that I do use AI. I use it primarily in my practice. When I'm looking up something, I might look up some, use an AI model to say like, what would be a good treatment plan for somebody experiencing this? That said, I don't generally rely on that as much, just because of some of the issues that are there. And I think my own, uh, gosh, I want to say like feeling of confidence in the information all the time. I do use AI though. In particular, I've been using Claude. I was using ChatGPT, and I had some issues with some of the ways that it was framing things, like saying things like, "Oh, that's so you, Keely," and really trying to dive into my psyche a little bit more. And so I felt like, it kind of went down a rabbit hole for me real fast. But I was able to, as a clinician, say, I actually asked it, like, "Are you a therapist?" And it was like, "No." And I was like, "Okay, then stop trying to talk to me about my feelings about, whatever thing. I just wanted more tactical information." I will say that I have started having conversations with my clients around their AI use. I have indicated to some that it might be useful in certain ways. So, for example, a communication struggle they're having with somebody or pattern recognition. So, putting in what's been happening to see if there's a pattern that kind of emerges. But I find that I try to coach people on a more kind of safe way or container around the use of it so that it doesn't go down the kind of rabbit hole that I was just describing that it went with me. Um, but personally, it is more of a professional thing that I use it for. So, for example, I might use it for these podcasts. I'll come up with a summary of what we talked about, and then I'll say, "Can you make this more polished?" Things like that. But in my clinical work, I haven't been really using AI note taker or some of these features that are becoming more normalized in our um, practices. So, to that end, what about the other people here on the panel? Are you using AI in any form, and would you be willing to share how? Yeah, who would like to go
Yeah,
first?
yeah, I can go first.
Great.
Yes, I feel like my use of AI tools is inversely correlated with the importance of or the um yeah, like the level of seriousness of the support I need. So, like I was wanting to get motor oil for my car, so I used AI for that. Although it was wrong, which was interesting. Um, and it was had a really hard time with being wrong.
Oh.
Um, which I also found interesting. But yeah, the motor oil it suggested was actually not what the manufacturer recommended. So
Mhm.
that actually ended up being more time. Um, but yeah, I'll use it for like personal accounting, making spreadsheets, um, putting together slides. I'll write up a lecture and then I'll just have it make slides and it'll make it a lot prettier and faster than I would. And I just go in and edit all the wrong things. Um, in clinical practice, I will use it. There are some certain HIPAA certified medical designed um, companies and softwares that I will use. and I mostly use it for checking drug interactions with medications. If there's something that I haven't really seen before in my own practice and we're live in the appointment, sometimes I will look up and say, quickly, is there any evidence that supports that this may be a result of this medication? And then I'll pull the study and read the abstract with the person in the room and kind of get a sense of how much I can attribute what's going on to the medication. Um, and that will help speed up the process instead of having them leave and then come back later after I've had more time to look it up. Um, and then I use scribe note takers and um, probably like a less efficient way, but a way that makes me feel better, perhaps. Um, so I use a scribe that's separate from my EHR system. So there isn't necessarily, and I know there's probably a lot of stuff that is protected and confidential, but at least for now, in this early period, it makes me feel better to have a scribe system that's HIPAA certified and medical that's separate from my EHR. So there's no direct link between my patient chart and what's being recorded, even though it's all deleted. Um, and I don't use it for um, therapy. I use it for medication visits. And then it's also kind of like an arbitrary line because some people I see for therapy, I'm doing a lot of medication intervention. Some people I'm seeing for medications and shorter visits. They're stable and we're talking a lot more about psychotherapy concepts. Um, but from I used to do a lot of insurance, and so the medication visits needed a lot more insurance compliance information that takes a lot of time. Whereas the therapy insurance wouldn't really, that wasn't part of the contract anyway. So um, I don't use it as much for therapy visits because I don't need that much information to go into the chart anyway.
Sure.
But if I was doing insurance-based therapy, I probably would because you need treatment plans and psychotherapy section. And anyway, yeah, I feel like that's a lot, but that's kind of how I've been
Mhm.
exploring it so far.
Yeah. Yeah, I appreciate you sharing. Well, definitely some of the things you brought up there, I think they're food for conversation in a little bit around some of these things, especially that EHR for anybody who's listening, that's electronic health records. And that's something that standardly a lot of clinicians use and medical practices use in general. And it's just a way that, if you've ever been asked to sign paperwork, for example, with your clinician, you're probably using an EHR platform to do so often, or unless the clinician is sending it to you directly. And then we on the back end are doing a lot of the charting and the all the kinds of things that need to go into that. Abby, what about yourself? Are you using AI?
Oh yeah. I'm usually kind of a mid adopter. I haven't adopted doing AI for chart notes yet, because I haven't really researched like the confidentiality, all those pieces yet. So I'm like not quite, haven't quite gotten to the point where I feel comfortable or being able to share that, explain it to my clients yet. And I'm not very good with technology. So, I'd love it if I could do something separate and, get the note, integrate it. But there's also so many steps in that's difficult. But as a I use it a lot in regards to, yeah, maybe refining what I'm doing, helping me refine, edit my articles. I go back, maybe there's some languaging differences that I want, or helping me structure things. And I think that is very helpful in my writing. It's been helpful in my PowerPoints as well, creating a structure, creating outlines, um, sometimes responding to emails. So one thing I find that's really helpful. So I have ADHD. As a person with ADHD, AI is an incredibly helpful tool for breaking concepts down. For if there's that, oh my gosh, I have to answer this email, but then I know there's so many of these steps and how I'm going to want to word it and it has to be professional. I'm just not in the mindset to do that. And I can just vomit whatever I think I really want it to say. And then it's going to spit something out that sounds professional and is more of the wording that I want to do. And I, of course, edit it that feels more to my voice. But I'm like, this is such an accommodation for being able to function and getting things done quicker, or, kind of an external executive functioning, that I find that AI has been very helpful for me in a process, is being able to produce things at a higher rate if I feel like I have a limitation around moving things forward because I feel overwhelmed by the activity. AI really helps me be able to produce something very quickly and really take a lot of the friction out, the hardest parts for me. Sometimes when I I don't ever put any client identifying information or anything very specific to my clients, but sometimes I'm like, I just don't know how to word this note in a way that's professional and clinically accurate, or how can I put this all together? And it's just so helpful in refining and clarifying for me. And so I love that as, first of all, as a clinician, somebody who wants to grow and develop professionally and better professional wording. That's not my personality. I don't think I have, that is not where my strength lies, in highly professional ways of like articulating. And so I find like that it's really helped me grow. I'm like, oh, that's a great way of saying that. I could do that again. So I can really use the tool to develop a lot of my own skills or really take a lot of friction out of my work. It saves me a ton of time. If I ever use it to kind of like, well, I have this concept and I see what comes back, like, hey, what kind of like almost like I'm talking to somebody else. It's like, what do you think? Like, what do you think are some things that are, accurate around this thing, or what is this thing? I can use it a lot as a referencing. And I've also learned to use a tool. There are different levels of accuracy within each tool. So there's ways that you can ask it to, yeah, exactly, give me the resources, where's your source material? There's the thinking, there's the scholar. Sometimes people can also be educated about, well, just because you're here using ChatGPT, there are different levels of how accurate or how deep a research or how long it's going to think out a problem. And so I've also cultivated that um, relationship with this tool about how well is this feedback going to do it. And I never take anything that ChatGPT is like that solid. I like to cross-reference and like look things up. But I think it's helpful for at least a stepping off point or an organizing of information. I'm like trying to think of what else I do in my personal life. I've like before we had this panel, because I don't normally ask it personal questions, but I thought I'm going to see what advice it's going to give me with certain areas of my life. And it was so spooky and it was really well done. But I've also seen the evolution of how it kind of was more, it wasn't as refined, really sophisticated in the level of sophistication now. And maybe because like what you're talking about, Keely, like so many people utilizing this tool, it's growing with our own, human interaction. So I just find it to be so powerful in um an accommodation as a clinician in developing my clinical skills. Is like taking a lot of friction. And also as a sole proprietor, I I don't have a lot of money to pay an editor for my articles. I don't have the finances to be paying person here and here and here to do all these things. And so this is a very affordable tool. I think it creates a lot of accessibility. Often people in the mental health fields were not raking in the dough and be able to pay a bunch of money. And so this is leverages us to better be able to produce materials of high quality and good references, um, and reduce the amount of time that it takes to do this type of work. I'm like, I just think it really is catapulting us in our capacity to be able to reach more audiences and disseminate other um, type of mental health resources. So I'm very excited. I could say more about how I use it, but I definitely find it's beneficial in those areas.
Yeah. Yeah, I'm curious, because of, I knew I was doing this panel and stuff, and just the more it's become around, I've started, just in the last couple months to start asking clients if they're using it. And I've gotten some surprising, like some people are like, oh, absolutely not, that I would assume would be, and then others that are like, no, should I? And then others that were like, yeah, I use it all the time. And I think some of those ones that use it all the time, it's almost informing the therapy work with me. And I didn't realize maybe that, they were coming with certain thoughts or expectations based on kind of what they were interacting with the AI around. So in your practices, have you started having those conversations with any of your clients, or have they brought it up into the room that they're using these? And if so, have you seen any kind of outcomes from that? Yeah.
Yeah, I wouldn't it's been a range for sure. I think also where we live and where I live and where I practice, um, there's there's a lot more awareness about it. People have kind of had their own process and decision making before coming to see me
Hmm.
and talking about it. um, but yeah, I mean, I've had some people that have said, I don't need to go to therapy anymore. I'm basically doing it all with this AI or that, especially for more what's the term? Manualized therapy they're like, I was doing CBT and I
Oh.
basically just started doing CBT with AI and I feel like I don't actually need to go to therapy anymore. So everything from that to on the other end, especially as a psychiatrist, seeing um, the kind of the evolution or exacerbation, possibly creation of new mental health conditions or flavors of how they present, um, where AI may be the entry or kind of um, uh, the match for a psychotic break, in which that kind of sycophantic intimacy confirmation bias really exacerbates and propels delusional paranoia, grandiosity, social isolation, eating disorders, as well as something that can easily kind of be propelled and worsened by interacting with AI. And then OCD and illness anxiety, whereas kind of like my area. You could reassurance seeking as a compulsion is like one of the most difficult things to kind of work on in relationships and with family. And so if you're going to this chat software and getting the reassurance you need, it kind of totally disrupts the process. So
Mhm.
um, there's ways in which I've seen it used that kind of creates or exacerbates mental health things. There's obviously all the information about more mild, moderate things or stress relief or cognitive behavioral principles that people use it for that they seem, at least for now, are getting benefit from and seem maybe to interact with professional mental health less. And there's obviously, my patients who are like, I refuse to touch that stuff. Both the programming engineers and people that are artists. So it's like a pretty diverse range of how people are thinking about it and interacting with it, and how then that is affecting them positively or negatively as they show up or don't show up um, in a professional space.
Hmm. Hmm. Do you see, sir, any differences in because I find for me it's interesting. Like I expected that younger generations would be more apt to use it for this.
Mhm.
And some of the research that I read out, like 1 in 8 adolescents, which went up to I believe 21. So that's kind of a younger population, 12 to 21. But I was expecting more of them to use it, and they've been a little bit less likely. I've heard from more of my older clients that they actually use it more. Have you seen any kind of differences in age related kind of usage?
Yeah, that's interesting. I'm probably not the best anecdote because I don't see people super young.
Mm.
Um, so I don't know how like 8-year-olds and 12-year-olds and 14-year-olds may be interacting with it. Um, if I were to draw any sort of like anecdotal observation, it would be uh it seems like the people who are the most busy or the most lonely interact with it as a demographic. And the people that have a lot of relationships or a decent amount of life balance or free time don't have as desperate of a need for it from an emotional standpoint. It's like a vacation planner and what car do I buy, or can you help me find like this pair of pants I love on sale at Poshmark? It's like it's more of a personal assistant tool than a coping um
Mechanism.
support. Yeah.
Yeah. Yeah, fair. What about you, Abby? Are you seeing this in your practice?
I am, and I've seen couples use it during challenging communication and, and having, analyze the discourse and where maybe they're not utilizing. I mean, I never asked them to do this, but where they feel like maybe there's a breakdown or certain tools are not being like based on, like say, the Gottman's communication principles. Where are we? Maybe we could do a better job. I was like, that is so interesting. I hadn't even thought about that. That is really, I think it's neat. The efficacy of it, I don't know. I find it fascinating. And I have heard other clients, using it in some ways, and we were like, it was spooky in a really good way. I was, and not, and by the way, and I obviously can't tell the story because it's too specific. But in a way that it's like the material, it was so existential and not therapeutic, and transpersonal, spiritual, that I was like, that is bizarre and awesome. And so, I mean, but then again, this is derived from human wisdom and knowledge. And so sometimes or I should even say human beliefs, because it's not all wisdom that it's being derived from. But, so I'm like, I think sometimes it's been very interesting. I haven't yet heard anything I haven't heard directly from my clients anything I was concerned of. Obviously, I've heard of plenty of troubling stories, and I believe in the accuracy of all of it, and I could go more into that, but we'll probably talk about that later.
Mm-hmm. Yeah, I think this is what you're saying. But people are coming in with professional language about psychological concepts that are not coming from you, that are coming from their inner.
Well,
Is that what
they
you're saying?
processed something they experienced, some kind of deep transpersonal thing. They said, "Hey, what do you kind of like? What are your thoughts around this?" And it gave some really like some amazing analysis, essentially, of it. Not necessarily some psychoanalytic perspective, but I was like, that is it's unfortunate because I can't say publicly was specifically what I wish I could have gotten consent beforehand. But and I thought that was amazing. So they're just using that tool as kind of like interpretation analysis of something that was happening for them. And I thought that is deep and that is really great. I wouldn't normally expect that. And my bias is that this can leverage that, but also but I'm glad this person brought it to me because even though it rang true for them and they, have the self-awareness to know the difference between something that is being subscribed to them, like, versus something that feels like accurate in the analysis of their experience. But I'm glad what they did is they brought it in. Hey, I thought this was profound. What are your thoughts around it? I don't, they have the awareness that because in the Bay Area, there's so many people in tech, they understand that we have to have a certain degree of incredulity around it. And then so we were able to talk about it, and I was like, whoa! But it really catapulted, it really sped up this process of like insight and integration that I was like, neat. I'm like, once again, and not then relying on it for this kind of analysis, but like it's, I think it like a journaling, kind of like a tool to or like even when we even when we open a book, it's not necessarily just because we use this book as a reflective tool around whatever our process is to help gain bigger insight. It's not, we have to know that it's because so and so wrote it doesn't mean it's accurately depicting like what we're feeling, but it helps us in our internal inquiry. And that's what was happening. I thought that's neat. That's neat.
Mm,
Yeah.
yeah, yeah, that is very cool, very interesting.
Yeah.
Yeah, I've seen it on the medical side. It's been fascinating to have people come when we talk about accessibility, we're talking about accessibility to, more mental health support. But I'm also thinking about it as another level of accessibility to information and medical information, which for our anxious folks can really backfire. Um, but it also is fascinating to have conversations with people that are using medical terms. Before you would, even with access to the internet, you would have to search on PubMed to find papers, or you would have to open a textbook of Harrison's or a pathology book to get this language. And people are coming in, they're like, oh, I'm not sure, like I have a skin rash. I don't know if it's like a cellulitis or erysipelas, or is it possibly like a manifestation autoimmune of and I'm like, I'm just like, it's like, am I having a conversation with a colleague or
Yeah.
with a patient? Um, but they obviously don't have the scaffolding for that information. But it's just been interesting that people come in with very specific medical information, because you can put a query in and within minutes, have textbook level information about something medical that's going on. Um, the flip side of it is that I've noticed, because I work in mental health and medical, that people might come in and they have a cough and they're like, well, how can I make sure it's not cancer? And then AI will say, oh, well, you need these labs, you need this imaging, you need this assessment, you should probably see a specialist. And so people come in with a cough and like, okay, I want all this done. I want a PET scan, you know, and then, the doctor, it's like, hey, like 99% chance this cough is not cancerous and it will go away. We're only going to do these tests, and people are upset because now they aren't getting like what they think is a gold standard high level of care. So there's so many, anyways, there's so many complexity,
Yeah.
so much complexity.
Yeah, it's like information is great, but it also is potentially dangerous.
Hmm, hmm,
Given,
hmm. Like you wouldn't
context.
normally like tell someone, oh, this could be cancer. These are all the studies we're not going to do because I don't think it's this.
Yeah.
So now, in primary care, your 15-minute visit is trying to talk someone down from needing a $600,000 workup for something that's probably going to go away on its own.
Yeah. Yeah, there was a recent Stanford study that talked about, you have both kind of mentioned, I think, stigmatization too of conditions. So they found with alcohol dependency and schizophrenia, it actually made it worse for people in those categories because they were going down kind of these rabbit holes, it sounds like, in the study of, especially like schizophrenia. It was too, I think, sir, you had talked about sycophancy earlier, and that is a piece of this that these chatbots are generally designed to encourage more usage, and they agree with you a lot. And so that kind of creates so I can imagine if somebody is saying, well, I might have cancer, and it's like, oh yeah, you might, let's explore that, right? There's this kind of agreement that might be happening. And while it might be beneficial for somebody like you were mentioning CBT, like kind of that high level, like CBT is one of the ways I work. I've actually, to be honest, been thinking like, do I reposition my work because I do somatic work as well? Do I highlight that more? Because AI chatbots can't really do somatic work in the same way that a human can, right? But I do think that there's plenty of studies, I think, that are looking at kind of the beneficials of kind of this mild to moderate use of it. But once you get into like kind of these deeper issues, that's where you start to see some of these things break down, even like suicidality. Um, like I was when I was kind of doing some research for this, one chatbot was telling me that chatbots are great at finding suicidality. I was like, uh-huh. And then you look at a study and it's like, often overlook suicidality, and if you say like I'm not feeling well and what's the closest bridge, how tall is, they'll be like, oh yeah, go, here's the bridge, go enjoy, and so they're not catching, whereas a clinician, a human might be saying, hey, why are you asking me about bridges after telling me you're depressed and hopeless?
Mhm,
Let's
mhm.
talk about that.
Yeah, it's interesting. The one of the articles you sent had talked about how a lot of people engage with it because of introversion or social anxiety, and it's much easier to confide in a non-person because there's not that judgment. Um, but at the same time, like the con is there's not that judgment. So there's not context about, oh, what's happening at school, what's happening in a relationship, how you look in the room, how did you enter into treatment, and then the thing that you're reporting, like, what's the tallest building in the city, or um, without judging, there's also potential to miss serious um, things that are happening in the negative space that are not being talked about that are driving suffering.
Yeah. Um, well, so you both kind of mentioned accessibility and different pieces here. Maybe we can talk about some of the benefits before we get to some more of those maybe harmful areas. Um, Accessibility is something I think that does play a part here. Again, there's a level of skill building or asking for I take a more coaching lens sometimes with this stuff of like I do think it can help coach you on communication. Abby, you were talking about like, how do I write this? I've used it for those kinds of things too, to say like, well, this is kind of a tricky situation. How should I frame this? I think for those kind of higher level things, there's a lot of ability there. And I was listening to I don't know if you guys are familiar with the All in the Mind podcast. It's out of the UK. It's based on it's clinical based, and they were doing one about AI chatbots. And one of the things they were talking about was this accessibility, that there is a really long wait time in the UK. And here in America, we have clinical deserts where there's no clinicians for, miles, if not, hundreds of miles. And people don't have the access. Abby, you mentioned like it's more affordable, like it's cheaper. There's pieces there as well. So I'm wondering, do you both also think that, these kind of pieces, like on this kind of more surfacey level, I almost would say that these kinds of things can fill a gap while somebody's waiting to get in with a therapist or looking to kind of, sir, you were mentioning some people saying, I'm gonna not go to therapy anymore because I can get it from this, but almost on the flip side, you see that this kind of aspect of accessibility is being helped by these, AIs.
Yeah, I would love, I mean, so this is okay. I was just thinking about, I was really happy with the idea of three of us because I always think that there is a conservative perspective, a moderate perspective, and like a very optimistic perspective around all these things, right? And I think it's always important to know that we can all occupy these different roles and there's not, and all these roles are really important. Like there's a very conservative perspective where people are like, we should not be having AI. It's just trying it's a tool just to sell things and to use it more, and it's just a black hole, and it's like like there's a lot of fear, but a good fear, right? It's called out a lot of the problems that we've seen. And so when I kind of one concern I have, this is my like pessimistic concern, is that well, to me, AI is not therapy, period. It's therapeutic, or it could be a therapeutic tool, or it can be a form of information, but it's not a replacement. And so it's great that we can maybe offer people up, just like some people might buy a book versus, yeah, a $10 book is way cheaper than going to therapy. But is it going to are you going to have the same quality of experience? And of course, it depends on the clinician, the same level of quality of experience in one-on-one, and like the depth of knowledge and wisdom, and like having some type of therapeutic relationship that really is truly attuned to you. And attunement means really seeing you in the holistic aspects of who you are and the intersections of what may be happening in this difficult, right? And some of the articles about AI also talks about how sometimes the cultural competency, in other words, maybe not being information is derived or written by, by dominant culture, and therefore isn't representative of the populations who may not be able to afford therapy, and therefore the having access to AI tools isn't actually going to be meeting those individuals specifically what they need. Okay. Or maybe it'd be invalidating, increasing marginalization, et cetera. I do think it does create a lot of access, to information, and there can be a lot of positive support that it can offer, but it is definitely not a replacement. My fear is, which is, kind of like we've seen in a lot of these large kind of corporate, supposedly nonprofit mindsets, is that, hey, we're going to do group therapy or group kind of psychoeducation classes, or we're going to create some type of coaching program or some online self-play. And it's like, these are not replacements for therapy. I love that there are these other options for people, but it's not a replacement. And my fear is there's this kind of this languaging, and I'm like, we're already kind of getting into this really inaccurate zeitgeist of like, it's going to be therapy. And like, we have to correct our languaging around that and be like clear that this is a stopgap a bit, or, but it's actually not like the replacement. And my concern is that large corporations are going to have kind of self-reinforcing research that says, yes, this is really effective. And I'm like, that's some bullshit. And, and I don't agree. And so I hate this. I almost feel like in some ways the slight hysterics around it replacing psychotherapy is reinforcing the concept that it's not it's not the same thing. And so is it a tool? Is it, maybe I can't think of the right word for it. Is it an accommodation? Is it something that I don't know what's a better word, synonymous with not replacement, but kind of allows, like, how like
Accessory.
aspartame and stevia is not a replacement for sugar, but it like kind of, it allows you to have some kind of proxy of the experience. But um and so I think we need to start like already, it's not a replacement. It's true. So kind of like I think we need to somehow even culturally start to differentiate that and not get into the hysterics, because it also reinforces that concept. But I think there is something great about it. I think we need to educate the public and also reinforce through lawmaking and reinforce in institutions that this is still not the thing. But and my biggest fear is, though, we're going to create this, but it's also going to be an opportunity for another glass ceiling, another way of marginalizing. Well, we gave you this. And it's like that's tokenism for real access to truly having healthcare in a sustainable way. And so that's a little bit of my opinion.
Yeah, fair, fair. Sir, is there anything that you would add to that?
Yeah. I mean, yeah, I think the language of like we're in a state of mental health crisis when it comes to accessibility and worsening um, emotional state of our population society over time. It makes sense that if we don't have enough people to provide a service, then technology would start to fill that gap. Um, I think the challenge is that the increased accessibility to mental health emotional support is coming from, at least in my current understanding, is coming from companies and software that was not designed for that purpose. Um, there's a tool that's created for a purpose, and then people are repurposing it for another thing that it's not really designed for. So there are probably a majority of people that will get benefit from I'm stressed out because I can't make a decision to do A or B. And then with context, it helps become a decision tool. But there are also people who are going to get hurt along the way, or may not survive along the way. And so I think that's just a really, things are moving without um, like the train is moving, but that I think I worry about the people that get harmed along the way as it sorts itself out, as companies are forced to become mental health companies in some way because that's how their products are being used. But the intention, I imagine, is to like create a really valuable tool that captures attention so that people stay using it and then they can get sold stuff. Um, so that's kind of like the big picture existential thing that I worry about with access. We 100% need more access to care. Um, and I think people are going to benefit from it, but people are going to get harmed too. And I also know that like the opposite is people are currently being harmed by not having any attention or being too afraid or stigmatization. Um, so I don't think there's a right answer that's going to keep up with the pace of development. Um, but I think that our input and value is as it's developing, like how can we protect people along the way?
Yeah. Yeah. Do either of you guys watch John Oliver last week tonight?
Used to, long time ago.
Yeah, he recently did a episode where he talked about chatbots, and in it they were showing an interview with Sam Altman, who's the head of ChatGPT, and it was kind of my final straw of like, okay, I'm definitely not going to use ChatGPT because of the way that he was framing this was like, well, yeah, people are going to die, it's just part of the model. And when you look at it on scale from these companies, like, sure, there's going to be some harm that is done, but for them, it's about the bottom line. And I think at least what I've seen with a lot of the startups that I've worked with or talked to, some of these founders, and there's some amazing ones, don't get me wrong, there's some amazing ones, but oftentimes there are people that have no clinical experience, they don't have anybody clinical on their board or around them, but they're going to save therapy through these AI interventions. And I think sometimes, while the intention might be really positive and wonderful and lovely, there therapy to me is so nuanced that it's really hard. This is such a delicate thing, and I think yeah, when we make it more of a broad overview or broad strokes of like this is helpful or not helpful, we're missing all those nuances in between that can actually tease out where it might be helpful, where it might not be helpful. And that podcast I mentioned, All in the Mind, they were sharing the audio of the chat bot, which I'm always doing it just kind of written, but they were sharing the audio. And what really struck me about ChatGPT's, therapy chatbot, was that it did things like what I just did. It said, interesting. It was mimicking human cadence and tone and the filler words that we use. And to me, that was like, oh, that's next level. That's working to be more like a human rather than just a tool that people could use. And this certainly it did say, well, that's something you could work, because it would say like, what should I do? I'm having a hard time with gratitude. Okay, well, you could work on compassion and have a gratitude journal. It was a lot of high level, to your point earlier, Abby, like reading a book might have. Um, and then it said, well, you could talk to a clinician about this stuff if it's more, interesting.
This is something I was thinking about. And as dark and I mean, I'm sure the way he said it was pretty inhumane. And the hard thing about technology is there's something accurate about the fact that as things evolve, they are like unsafe. Cars are unsafe. The internet is unsafe. Yeah, AI is incredible. There are things that they have made certain safety precautions they knew right away. I mean, like literally creating new designer, what are they called? Not ChatGPT, but on the government level, like designer illnesses, like certain type plagues, like things that you could use in wartime to wipe out other countries. Like there's not, it's like very much creating technology. Their AI has been used to create technology for military purposes. So we know that it can be incredibly dangerous. And I also want to say, yeah, there is a degree of, yeah, it wasn't created for mental health, and that's how we started to utilize it. We utilize a tool not for how it is purposely. It will be dangerous. I mean, I think it's difficult in growth and then how it become, thinking about the internet and just leveraging predators, you know, and so, and the internet and social media, once again, really, there's so many problematic aspects and deeply problematic for, especially for developing adolescents and their mental health. Like we know the research now, and the internet allowed for, I think, a lot of dissemination of information and allowed marginalized communities to communicate with each other. And like you think of the LGBTQ community being able to have access to each other and normalization and access to being able to get out of unsafe situations. And so it's like there can be the tool of, it all depends on how we wield the tool. Is it wielding a tool of oppression and destruction, or is this like, and then can people also use it for access to being able to, for empowerment or safety? And I think it's right. I mean, even doctors becoming better doctors. Well, I mean, I don't know how accurate, sir. You can please correct me. Maybe I watched too many scrubs or something, but it's like, yeah, people will die. Clinicians start out as little baby clinicians and they miss suicidal ideation. We miss things in the beginning and we, do harm. We really do. So things in their infancy are dangerous. Even starting out as a clinician, I'm like, luckily when I had missed something, I can't tell the story, but I'm like, and I later got consultation, like, you should have asked about that. And I'm like, ooh, so yes, of course, it requires, they need to have, I mean, having dialogue with professionals and when there's these important guardrails, it's like we need to raise a, alarm, we need to have responsiveness. And we have to realize that even the clinicians that are out there are licensed, been licensed for years are still problematic and dangerous. So it's like, are we also holding it to the same standard, even as human beings, as any other tool we've used? Or it's new and it's not yet normalized yet. And so, I mean, like in some ways, like, yeah, it's dangerous. He's not wrong. At least he's taking some degree of ownership rather than being like, what are you talking about? Like, no, people, whether it was drugs that we have developed, people are going to die. And so, and that's sad and that's scary. And I'm not saying that we shouldn't be taking action towards it, but I don't think it's always the indication that then we have to completely shut down progress around something. I think we just need to develop better systems because we just had such a technological boom. We just need better systems and better laws about how to deal with these things. And we have learned more as a society about how to respond to these new technologies and have a certain degree of um, what's the word I'm looking for? Not incredulity, but like, skepticism and or like, okay, maybe I need to like investigate this more. But of course, folks who may be already really vulnerable, yeah, it's definitely going to be far more dangerous for them. And I don't just accept that as a clinician from my place of privilege. I'm not just like, that's fine. I have all this privilege, so I don't care if it happens to somebody else. But I think we need to be like honest, about our already existing margins of error.
Mm, mm. Yeah, yeah. I feel too, yeah. Because if I'm thinking like a doctor, um, if you if there's a mistake that happens, which mistakes happen, um, you are liable for that mistake. And it's unlikely that the mistake was done um like with negligence or malintent or you're trying not to harm. So you won't do an intervention even if it may be helpful if it's also going to harm the person. And so it's interesting to think about like I don't not as familiar with the ChatGPT literally therapy software, but if a company is going to actually start to do clinical care, you also have to be responsible and like not intervene if the harm is worse than the benefit and have the judgment to know when that's the case.
Mhm.
Um, And so I think that is some of the nuance that's difficult because outside of clinical care, like if I'm at a coffee shop and you order 6 coffees, I'm probably going to give you 6 coffees. And then if you go drink those 6 coffees and you have a heart condition and you have an arrhythmia and you go into cardiac arrest, the coffee shop is not responsible for you taking that tool, using it inappropriately, and then being harmed or dying. So there's kind of this weird it's in this gray zone of like, are you producing a product that's supposed to be a clinical intervention, a clinical tool? And if so, then are you liable? But if you say you're not, but people are using it that way and get hurt, like who? And I think that's the part because it's not a person um, that I'm having a hard time figuring out where the harms will come if we intervene or not intervene, but who's responsible if we intervene and a harm comes.
Mhm. Yeah, Abby, one of the articles that you had shared with us prior to this as well, it was struck me one of the things it was talking about is that AI, like some of the ways that they're figuring out where these harms lie or how effective it is an AI chatbot is talking to another AI chatbot that then is getting analyzed by AI to see if it was effective.
Mm,
And nowhere in there is this like human, real life kind of, situation. And I think the dangers for harm around those nuances really kind of it's kind of like any study, right? When you look at a study, I don't know about, I'm sure the two of you are similar that I'm looking at who's funding that study. Where is it coming from? Like what kind of journals is it actually posted in versus so for example, like, I'm thinking about like an example that comes to mind is the milk industry would fund things about how effective milk is at, calcium and bone health and all these kinds of things. And I feel like there's this same thing kind of going on in some ways with some of this research around is this effective? Is this useful? Is this harmful? And do we actually get a real picture of that? And then to your point, sir, it's like who is responsible for that? If the harm comes to somebody, am I as the clinician who is working with them, but I didn't know they were using this, or even if I did know, I'm not with them when they're using it. So am I responsible for that chatbot, telling them something that could be harmful? It raises a lot of issues. I do feel like we're just scratching the surface. There's so many things that we could talk about in this conversation here. Um, but in the effort of time, because we're coming up on almost an hour here, um, is there anything that just to kind of summarize or that you feel like, like some things we didn't talk about, like we didn't talk about privacy. It's a major concern, at least for me. Like people don't realize when you put into ChatGPT, that's not private. You sharing your medical information or whatever, they have a newer model, I think, that is designed for medical, and you can upload your medical forms. I think Amazon has their own, AI bot that you can upload all your medical to me, that kind of information that's the scary part too. I don't really want chatbots that don't have confidentiality. Like the three of us are all, covered by certain HIPAA, electronically, as well as our own kind of legal and ethical guidelines that we have to maintain privacy. Just like Abby, you weren't able to share certain things in this, talking because, it's private protected information. So that's just one that comes up for me, kind of in a wrapping up here. Are there things that you think that people should be mindful of or aware of as, we kind of move into this, future with AI from a clinical standpoint?
yeah, I think there are definitely companies and softwares that are kind of gaining trust within the physician community as far as privacy and security. And I think um like we can do what we can as far as vetting and things. There's always a risk, just like, as soon as we went to electronic health records even having paper charts in a room in an office that could be there's kind of always that risk. You can't guarantee confidentiality, but you can certainly make the appropriate efforts to take care of people. And so I think there are ways to do that. Um, I think it's important for people to know whether, like, whatever they're using, whether or not how secure it is and how private it is. And certainly in medical education, we discourage anyone from using kind of the more popular softwares because they have none of these guarantees, and there are ones that do. Um, so yeah, I think it's a huge concern, but even such, we're still trusting, just like we trust when we put things into Epic that maybe it won't get hacked, or when it does get hacked and there's a ransomware thing, that they'll do everything to try to keep things private. But there's always there's going to be the pressures that we felt around privacy are going to be the same and probably more with advanced tools for malintent and for what I wonder is, like, how much more burden will be on us to try to as we use new tools to do more things for securing the environment. Do our practices need to operate in VPNs? Do we need to have local servers to not be accessible by hacking attacks? There's so many future skeptical things I can think of, both positively too. Like, if you have an AI system, Abby, in your practice, and it's the Abby AI, and your patients journal in it, and then before you go into sessions for the day, you get a digest of what's been happening with your people over the in between session. And then that helps inform things that there's not time to talk about, or there's negative space and they're unaddressed, or maybe they couldn't say it to you, but they want to say it to you, but can't say it to your face. Like, that could be really cool. So there's also ways to kind of speculate about um, future ways that this could really improve quality and deepen human relationships. It's just a matter of, like, I'm not a programmer. I don't know if anyone, uh, you know, I don't know how much that matters to, versus doing the things that scale and make more money. Anyways, that was a bit of a ramble, but
I
lot
think
of,
a valid one.
I think you invented some really great AI tool for therapists there. I was like, that's so cool. Yes, please talk to somebody, yeah, contact us about that because that's amazing. I'm like, yeah, that's true. And I do want to say though, we got to remember that some AI tools are also trained by humans. They're not all just like design, but yes, AI bots can make other AI bots, but a lot of tools are trained by human beings. But what we need, because they do it like one thing at a time and the most painful. Well, I know of programmers have seen them use tools and they're like, oh my God, I'm so glad I can train this AI tool. But they also need to be trained by us. I think that's like the big gap. Like you said, it's like, I didn't know there's chat therapy. Sarah, you're right about like, hey, if they put chat therapy out there, then and they're saying other people are going to, that is to me not acceptable. If it's just a chat GPT, I'm a little bit like, but, but there's just not the conversation I've seen, like you said, Keely, early on. Like there's so many things people make with good intention and they call it like therapy. And you're like, first of all, I almost feel like we need to not allow that. Someone can't call themselves a psychotherapist and they're licensed. I think we need to, in some ways, I think we need to maybe clamp down on some of this nomenclature so that it's not going to be misinforming the public, and some better law, maybe lawsuits. I don't know. But I think there's some of that like misinformation component that we need to do a better job, which is hard as clinicians because, we, like at least therapists, master's degree therapists, we don't have a lot of money and capacity to like leverage. We have enough things we're trying to leverage protecting the public around. But I think there just needs to be more conversations with the clinicians who are actually doing the work and like understanding what our work really is. I think there's a lot of misunderstanding about what therapy really is, and like 20% of it at least or more is the relationship in of itself. So it's just AI can't replace that. And frankly, I think more people are coming to therapy because of the isolation that they experience from pseudo relationships through other forms of technology like social media. So I'm like, in fact, I'm like, I hate to say it, this is going to give us more clients than it's actually going to draw from our populations. And that my hope, in fact, as a clinician, is I'd love for my job to disappear. I would love it that if socially we figured it all out and we used the AI tool and no one ever came to my door again, I don't know what I would do, interior design, I guess. But that's literally my backup job. But like I'm not educated and but here I'll go and like when I'm 60, when AI completely educates everybody and everyone has a great communication pattern, they never need me again. Fantastic. But that's not going to happen because we need like real relationships. So that's why I don't get freaked out. The only thing that freaks me out is how unethical companies are going to try to use this as a way of not paying clinicians and giving access. I think there's a lot of clinicians, but I think because insurance companies won't reimburse us, they won't get us paid. And of course, most of the general population can't afford to pay us out of pocket. And I can't be poor because insurance won't pay well. And I just can't. I have to pay for my home and I have a child. So I think some of that is like there's a general institution around like connecting access to clinicians in a non-exploitative way, and obviously that's like another forum. But I was just thinking it's complicated. Life is more complicated, like as a parent. And I think about having to parent around social media, around technology, and it is more like we're it life used to be not this complicated, and now it is more and more complicated. And it is hard to figure out where's the onus of responsibility as we're getting, in some ways, these tools are helpful because they leverage us to having less complicated lives and be able to do more. But sometimes in the action of doing more, our life isn't actually less complicated. There's just a greater expectation for output. And I don't know if the right terminology is what is it called, a post, capitalist society, but we're supposed to do more and more output. And maybe that's some part of the problematic thinking is that, but there's tools and we can have more output. And maybe that's part of the problem is that maybe we have less of technology necessarily to that is actually kind of becoming more of like the busyness. And we need to actually turn towards like real relationships or other things that are I think more directly going to feed us as individuals. So I always think that this is the complicated nature is producing more things, but to what end? Is it just making things more complicated in a way that doesn't need to be? So
Mhm.
I also kind of feel like where are we going with this?
Yeah, that's a really astute point because I feel like especially in medicine, the push of the EHR has been like for productivity, see more people faster. Um, and then with more technology, I think, like you're saying, the natural expectation is that now you have one doctor for every 10,000 people. Um, and yeah, I think it's a really important, that's like a nice place to leave it. Even like my patients who are working in making AI soft, like they're like my work has never been this hard, actually. Like I'm working more than I ever have before because now my company says because I have I should be producing 10 to 20 times what I was before. And like I'm probably doing 5 to 7 times more with the AI, but now to get the extra 3 to 5x, now I'm working on weekends and I'm just like calling nannies to watch my kids. I don't see my kids. So it's like, I think you're touching on something there that I'm even seeing now in 2026 in a way that I didn't see last year
Mhm.
across multiple industries, including my own.
Mhm.
Yeah, it's scribes, right? Like even we had a AI workshop for the program that I teach in, and someone's like, "Yeah, I'm like." Before I was seeing maybe 12 patients a day because it would just take me so long to do notes. Now I'm seeing 16 to 18, um, or 18 to 24. And so, yeah, um, yeah, it's just, I wonder where it goes.
Yeah. Where's this going? Is it really leveraging what we want? which is joyfully connecting with each other, doing meaningful activities and self-expression and just like being. But so I think that's what I think of also as a clinician. It's like to what to is that the big conspiracy, right? To the end of more production of technology. You're like, so we could be more efficient as humans. It's like, no, I don't know.
Yeah.
But this is that's yeah, it's kind of a fun notion of um you know, what do we want from this? What do we want? Not even what can we do, but what do we want? Can we even ask that primary essential question of like, we, what was it? That's from Jurassic Park. Just because we can, should we do it?
Yeah, I think it
Mhm.
was like
Mhm.
Goldblum or something. It was
I
like
know.
very good.
Did they ask themselves, should they? It's like, yeah, it's like, are we producing and we're missing the human where it really comes back to not just creativity, create real creation, but with intention.
Yeah. Yeah, I would echo all that you are all saying here. I think, yeah, there's so much potential and to what end. And I do think, just as a final thought, like we are in the business of human connection. Like all three of us are, we're in the business of healing people through connection and healing these kind of wounds that have happened. So, you know, I'm all for something that's going to help me do that and not necessarily something that's going to get in my way of that. Well, thank you both for your time and energy. For anybody watching this, I will include both Sir and Abby's information, so you can reach out if you'd like to, learn more. I will also include links to their full interviews, so you can see them chat about their work a little bit more in detail. And just to both of you, thank you again for having this conversation with me. I think we just again scratched the surface, so. Maybe we can do a part two at some point because there's so much more here I think that we could talk about. So thank you.
Thank you, Keely. That was fun.
Yeah. Yeah. Thanks for the invitation.
My pleasure. My pleasure.